Hey everyone, thank you so much for coming and taking the time out of your day to attend today's episode. This is brought to you by Stanford AIMI, and AIMI's mission is to responsibly innovate and implement advanced AI methods and applications to enhance health for all. My name is Arav. I'm a third-year undergrad here at Stanford studying electrical engineering and computer science. I'm really passionate about applying ML and robotics to the assistive technology and medical fields, as well as AI chips. In the past, a couple things I worked on were a robotic arm to assist elderly and disabled people, as well as some AI hardware research. And previously, I did intern with AIMI to create an AI pipeline to identify and sort of box various tubes in chest X-rays.
Hi, my name is Nidhi. I'm one of the other moderators for today. I'm a freshman at the University of Washington studying computer science. I'm passionate about applying technology to address real-world challenges and to make a positive impact. In high school, I worked on several AI for health projects, and I was able to publish and present my research at conferences. And I'm also currently working as a research intern at Stanford's Institute for Human-Centered AI, where I've been working on projects exploring how AI can support journalism and education. So now to kick us off, we wanted to announce the launch of AIMI's Academic Year Internship. So this year we are going to have 36 students working in small research teams through the academic year on projects exploring the intersection of AI and health. And then their work is going to culminate in presentations during Stanford's Health AI Week in June. And we'd like to give a huge congratulations to this first ever cohort. It's really great to see how AIMI is continuing to expand these opportunities for high school students to get involved in AI in medicine.
Yes, so that was our academic year internship, and we also are very excited to announce our summer 2026 programs. So we have a summer 2026 internship and a boot camp, and both of those applications will be released on December 15th this year. And there will be an info session on that same day from 5 to 6 p.m. PT. And the link to register will be posted in the chat. And also, we wanted to announce Stanford's annual AI Plus Health Conference, which is Stanford's largest convening for AI for health and medicine. And it'll be taking place virtually on December 9 to 10 this year. And registration opens in 2 days. So see the link in the chat for more information. And now we have the pleasure of introducing Dr. David Rhew. So Dr. Rhew is the Global Chief Medical Officer and Vice President of Healthcare at Microsoft, where he leads efforts to transform healthcare through technology and innovation. He also chairs the Health and Fitness Technology Division of the Consumer Technology Association, serves on its board of industry leaders, and teaches as an adjunct professor at Stanford School of Medicine.
With a background that spans medicine, computer science, infectious diseases, and multiple leadership roles across healthcare and technology, Dr. Rhew has been a pioneer in integrating clinical decision support into electronic health records. Now let's give it up to Dr. Rhew.
All right. Hey, everyone. Thanks so much for joining. I'm really excited to be here. I even got in the mood. I'm wearing my Stanford shirt here. So I wanted to just tell you a little bit about myself. And this is going to be a little different, this type of discussion. Normally, I talk a lot about AI and where it's going, but I wanted to talk a little bit about my career and some of the things that I've learned, and specifically as it pertains to AI. So I have some slides. I thought that could be a good way to help frame some of these conversations. So what I wanted to do is I wanted to first answer one of the big questions that I oftentimes get, which is like, what does the chief medical officer for Microsoft do? And I'd say in general, that's a question that I get from everybody. In fact, my parents would like to know the answer to that. And the answer is, it is really more of a translator role. There's an incredible amount of technology that is being developed. It's constantly changing. And then there's a tremendous amount of complexity on the healthcare side. And figuring out how the technology, specifically AI, can be applied on the technology side is a bit of my role. And I want to tell you a little bit about how I got there. So to do that, let's kind of go back in time. I'm going to go like way back, to that back when I was a kid. Let's see if I can advance the slides here. Okay. All right. Okay. So like when I was back a kid, okay, so this actually isn't me, but it reflects kind of like my attitude when I was a kid, which is essentially, I wanted to learn as much as I could, and I wanted to find tools that could help me learn as much as I could. Now, unlike this kid, I actually didn't try this methodology. I'm not sure if it works. I'm pretty sure it doesn't. But what I did do is I did spend a lot of my time trying to become a good student, and I think that's literally what most people think is the basis for how you start a career. But I've learned a lot since then, and I think many of the learnings have caused me to pivot in my career in ways that I hadn't anticipated. So I want to talk about three of those pivots because they essentially were not just things that impacted my life, but are potentially things that I could say are maybe lessons learned for me. So the first pivot for me was, after grade school, I went to undergraduate, and keep in mind, this is the 1980s, and a lot of people in the 1980s were playing video games, but not the video games that you all are used to, because I'm sure many of you have games at home. Having a game at home was like a dream. We could never envision that. We had to go to a place called an arcade, and they had these stand-up machines. I'm sure some of you have seen them. They're like in museums right now. And it allows you to be able to play a game, but it required a quarter. So quarters were extremely valuable. You'd kind of like, and I remember like not only playing the games, but I would watch other people play video games. In fact, it was kind of like, the early influencers. You had somebody who was really good at the game, and you just sit there and watch, and you just like watch how good he was, and it was just amazing. And I actually was super fascinated by the whole concept of video games, and not just playing them, but also there was an element of creativity about like what was the next screen and what was actually going to happen. There was one of the games I really liked was called Donkey Kong, and you always wondered after you got to a certain point, after could you save the princess? Could you actually do what if you actually went to the next screen? And there was this book that I used to read. I don't know if any of you have ever seen this. It was called Choose Your Own Adventure. And when you choose your own adventure, you get to the bottom of the page, and then it gives you like two choices, and it says, if you want to go to this path, turn to this page. If you want to go to this path, turn to this page. And I always thought that what a cool idea. Well, I wonder if I could make that into a video game. So in the 1980s, I was going to school. I went to school at the University of Michigan, and during that time, I was thinking, boy, you know what? It would be a lot of fun. I want to be a doctor. I was kind of like in my DNA. I always kind of knew I wanted to do something to help people or in society, but I also wanted to play video games and make video games. So I said, well, I'm going to be a computer science major, or at least I'm going to take classes. And as I took those classes, I really enjoyed it. And it ended up being one of those things that I ended up majoring in. And I remember thinking to myself, oh boy, you know what? I have to have research because if I'm applying for med school, I got to do something. And I looked at all the options that were available. And the only one that seemed interesting was this professor that was doing work on echocardiograms, and he was using AI to determine the ejection fraction for that. And so I said, wow, what an interesting. First of all, I had no idea what an echocardiogram was. So, it was basically the ultrasound of the heart. And I said, wow, you can figure out how hard it's contracting just by looking at this. And I thought that is such a cool idea. And I started working on these type of programs. And honestly, because I wasn't super knowledgeable about computers at the time, I was just starting to get my understanding of what was going on. And this problem, even today, we still struggle trying to solve it. So it's not like we've solved this in the many decades that have passed. But at the time, it got me exposed, and I said, you know what? I'm going to major in this. And as part of a major, you have to actually write a thesis. And my thesis at the time was AI in healthcare. So this is in 1988. And it kind of got me down this path of thinking about how could I converge this technology with this other passion that I had, which was being a doctor. And it was funny because I think today a lot of times people say, "Oh, that was incredibly prescient. You were forward thinking." It had nothing to do for me about forward thinking. It was just I kind of liked this. I was really passionate about it, and I was excited to do it. And I saw this convergence. Now, at the time, a lot of people, it's interesting because you would think that everyone would say, "Oh, go for it. It's like so exciting." Actually, if anything, I got more, are you sure you want to do that? It's not really something that is kind of in line with being a doctor. And if anything, I got more discouragement, even from advisors. Advisors would tell me, to get into med school is really competitive. You got to have really good grades and really good scores. it's not likely, and you're going to spend more time doing like programming, and it's not going to really help you. So I was being discouraged by everyone from, my advisors to, to even my parents saying that, are you sure you want to do this? It may not necessarily be the right path, but I did it anyways. And it was something that I, kind of for many years when I was in med school, I never even thought about it. I just, went down the traditional path. And then what happened was I was going through my medical school, and I was trying to figure out like what I wanted to do after that. And I said, well, I'm not quite sure, so I'm going to go down this path of internal medicine because it gives you a lot of options. And so I did a internal medicine residency. And after that, I said, I still don't know what I want to do. Everyone else is going off and doing something. So I decided to do a fellowship, and that fellowship was in health services research. I really had no idea what health services research was, but it turns out it was actually one of the most important fellowships that I could take, and I would highly recommend it for anyone. You don't necessarily need to take a fellowship to do this, but what it teaches you is how to evaluate studies and how to perform ROI analysis. And it's so important to have that understanding because no matter what area you go into, you're always evaluating. You're always trying to figure out what's the impact of this. And is this structured in such a way? If let's say you're an investor and somebody's asking you or showing you about their new product, you have to understand, did they evaluate it properly? What were the, what were the results? And so this whole concept of understanding how to evaluate studies and ultimately how to present information to individuals to help them make decisions was such an important part of that training. And at the time, I was, again, I was a research fellow and this was now at Cedars-Sinai. Here's a picture of Cedars. Uh, the pivotal moment was an individual named Neil Patterson. He's the late CEO of Cerner, which is now called Oracle, came to visit Cedars and he said, you know what, I'm interested in this evidence-based medicine, this thing that you all are working on. And I want to know, how does the evidence-based medicine get into an electronic health record? Because at the time they were the largest electronic health record, bigger than Epic. In fact, Epic was really not a big player at the time. It was just starting out in the ambulatory space. They didn't even have an inpatient system. And so Epic was sort of much farther down the road, but Cerner was the big player. And so the largest company, the largest electronic health record, the CEO of the largest electronic health record company was coming in to visit us. And he said, I want to know what's going on. And I was asked to present to him. There were several others that presented. And so what I did is I started tapping back into my computer science days. I said, I need to find a way to take this information and present this into the clinical workflow. And now I'm a clinician and I understand the workflow. And I said, one of the things that it takes a lot of time to do is when you're entering orders, you have to go down to all these drop boxes and everything. And I said, well, couldn't you just create a menu? And so that menu ended up becoming something called an evidence-based order set. And so I built this prototype of what an evidence-based order set could look like. And I showed how it could integrate into the electronic health record. And I talked about XML. And honestly, it was a prototype that looked good on PowerPoint or in presentation, but it really wasn't a real product. I guess you could call it vaporware. And Neil, Mr. Patterson, said, I like it. I want to buy your company. And so that kind of pushed me into a different direction. Now I was part of the Department of Health Services Research, which had just become a company called Zinx Health. And I'm sure there were other reasons that he was interested in Zinx, but that was one of the products that ultimately became the flagship product for Zinx Health. And it then became the most significant product during go lives, because it turns out that to get physicians in particular or clinicians to adopt the electronic health record, the biggest barrier was the amount of time it took to enter orders. And so by using these order sets, they could reduce the time required to enter orders by about 95, 98%. And it became one of the central musts for every go live. And next thing I knew, I was in this process of implementing order sets across the country and also across the globe. We were like, it was just sort of like catching fire, so to speak. So I ended up, spending a lot of my time learning about electronic health records and the data sets that were behind the electronic records and interoperability in how to make things, leveraging certain type of standards. And it was just an immersion into healthcare informatics. This was even before healthcare informatics was a profession or was a specialty. And so we were sort of pioneering this space in which we were starting to learn more about how to do this. And it really pivoted my career pretty dramatically from this concept of clinical research to real world application of this into a technology, which is now in the, people refer to this as bioinformatics or just informatics. And but it was really just the first entree. And so this was in the 1990s. And so I ended up doing this for over a decade. And that was, a really good experience for me to understand how clinicians work within a hospital and a clinic. But I had always wondered, like, why is it we couldn't do the same thing for patients and for consumers? If we could bring that to consumers, that same concept of bringing the right information at the right time. And now what was happening was everyone was starting to use the smartphone. And so I said, well, why couldn't you use the smartphone to be able to kind of deliver that same type of information? And so as I started trying to explore that within the EHR world, I kept on realizing that that wasn't really their core competency. They're not a consumer technology company. They're more of a medical technology company. So I began to talk with other companies, and in particular, there was a company called Samsung. I think many of you are probably familiar with Samsung. They make TVs, washing machines, but they also make smartphones, and now they also make wearables. And Samsung was very interested in something which I was quite knowledgeable about, which was electronic health records. In fact, they have an electronic health record in Korea that they wanted to bring to the US. And I remember them asking me a lot of questions about how would you recommend that we enter the US market and what would we need to do. And I was really impressed because they had built a fully mobile EMR. It was something that was on the phone, the tablet, and I thought the user experience was pretty elegant. And so I said, I said that, look, I'll help you. The more I began to help them, the more they realized that the more they needed me to help guide their organization. And then they said, you know what? We need to have you join our group because we don't really have as much knowledge about EHRs in this space. And I said, well, I'm really not too interested in moving to Korea at the time. So I said, well, I'm not so sure. They said, no, we really need you. So I said, okay, there's three conditions. First is I'm not going to go to live in South Korea. As much as I'll visit, but I'm not going to live there. Kind of like, pretty happy here in the States. The second is I think that there's more to it than just simply the electronic health record. I'd really like to explore this thing called digital health and connected care and smartphones and wearables and sensors and they said that's fine. And the third is I said I'd like to be your chief medical officer. And they said, "What's that?" And I said, "I don't know, but I want to be it." And so I ended up being the first chief medical officer for Samsung. And at the time, there were really no chief medical officers at the time, but it really did kind of get me down this path of working with large organizations and trying to get things done. And I can tell you there's been a lot of learnings that I've had since then. And so, these kind of pivot points in my career were very unexpected. The fact that I started doing something in the space of electronic health records, or I should say in the space of technology and specifically AI, and eventually it converging into the things that I would actually be doing today now at Microsoft. So I'm going to kind of pause and then talk a little bit about like, well, what's in it? Like, what are the lessons learned for high school students and for college students and for other folks? Because right now we're entering into this new phase, and seems to be taking over, and a lot of people are very excited, but a lot of people are very concerned as well. And one of the second most common questions I get is, what should I do with my career? Am I going to be out of a career because AI is going to take over my career? And so the learnings that I've had and sort of my experience have given me sort of an idea that perhaps maybe we need to start thinking about how we all need to reinvent ourselves. So like I kind of reinvented myself fairly early, and it's always better to start earlier, but it's never too late to reinvent yourself. And the three things that I would say need to be done to reinvent yourself are you have to have a certain amount of information about the space you're going into. So if it's AI that we're talking about and how we become much more knowledgeable of how to use AI in whatever profession, it could be medicine, it could be in finance, it could be in law, whatever it is. We just need to understand the basics. And there are actually a lot of courses out there today. Stanford has a lot of courses, the courses, University of Washington has a lot of courses. These are both online and in-person courses, everything from what is AI, what's responsible AI, what's machine learning, what's agentic AI, things like that. So curriculum is a really good starting point. But I think most people just stop there, and that actually is not where you need to stop because part of what I've learned is you actually have to have hands-on experience. And that hands-on experience means that you have to understand how these tools are used. Now, some people are quite good. They're using ChatGPT all the time. They're starting to write code. I mean, they're just doing amazing stuff, way more advanced than what I am even able to do because they're just like totally immersed into this. But that's something that is so valuable. And at an organizational level, the way you get your employees, your faculty, everyone, your researchers to really understand how to get immersed into it is you actually have to create a safe environment. And as much as we love the things on the internet, if you're working with information that's confidential or private, you just can't simply throw it into ChatGPT or Bing or wherever because in general, these are the things that are secured in your own environment. So what you have to do is you actually have to have a mechanism where that information can be managed in an enterprise secure environment. And now we start seeing those things. And so once you have that, you create these environments where people can actually now start playing around with it without having to worry that the data will get leaked or the prompts will get exposed. And so much of what we had talked about before, there are paths to doing that. And then from there, you can start building your own understanding of how things will work. And in some cases, the individuals design the paths or the uses of AI that we haven't even thought of. And those are the things that need to be then brought to people's attention and ultimately made into real, applied in a real world setting. And so experiential is sort of that second piece. The third, though, is something that would be really great if we could do. And it is not only just knowing how to do it, but becoming proficient at it. So, back in my career, I kind of learned how to do things, but I did have to learn over time to become quite good at it. And that level of proficiency is something that there does need to be some kind of eventually a training course. Because at the end of the day, it would be fantastic if we could actually, have a job training course that teaches us not only what to do, but teaches us a job on how to do it and become proficient at it so that in the end, AI creates jobs instead of taking away jobs. And so that's kind of the three things that I would say that, as an individual and organization, we all need to do. And, my big takeaway is, reinvent yourself and reinvent yourself in this new world of AI. So let me just kind of close with some key takeaways because I want to see if there's an opportunity for some questions. So the first is that I've had many advisors in my career. My parents, the first advisors, and they all mean well, but oftentimes their perspective is very limited and very narrow. And I think as a student, as someone who oftentimes is trying to be respectful, we oftentimes take the advice of advisors and just go with it. Most people are focused on what they see in front of them. What they see in front of them is it's a competitive world. You need to focus and hyper focus on things. When in the reality is, when you're younger, now is the time to explore different things. It's the complete opposite. Hyper specialization too early is not good. Hyper specialization may look good on paper, but it actually, if you're going to do that, do other things, sort of cross train, so to speak, and do what you love to do. That's like really important. Okay, so that's the first thing. The second thing that I learned is that you have to learn how to sell. And what I mean by that is not selling necessarily products, but selling even yourself, understanding what is it that you do, what is that you do well, and how do you position that? So like my pitch to Neil Patterson was the very first sales pitch I ever did. And fortunately, I hit it out of the park because he got the idea, he was excited about it, and he wanted to move forward with it. And that's the type of stuff that you need to understand. You need to understand how to be able to best position whatever it's your product, yourself, in so many things. And I don't know if you've ever seen this movie, Glenn Ross, where he talks about the ABCs, always be closing. Like you need to always be thinking about how can you best position yourself and position yourself in ways that can lead to sort of like either we'll call it a sale or to someone accepting your ideas. And maybe one of the best examples I ever heard in my career was the story of how Brazil won the Olympics in 2016. Because I think most people are convinced that the best products always win the sale. And oftentimes we're like, looking at that as, oh, that's the reason why we perform. But to actually win the sale, you have to tap into something deeper, which is emotions. And a lot of times the emotions will override the logic of the fact that one product may be better. So in the course of, and this is a story that was shared to me by folks that were involved in the process, in the course of selecting which country would be the one for the Olympics in 2016, they had decided that they were going to rank all the ones based on a set of criteria, which were which were the ones that had the most things to offer, the safest countries. And there were a lot of the same ones that you saw, like the US had several up there, several in Europe had several up there. And kind of near the middle to lower was Brazil. They were struggling a bit with some of the things in terms of maybe it wasn't the safest, the cleanest, all the things that one might see are really important. But they had a pitch, and their pitch was that when they went to the Olympics, they said the Olympics is about the world, and the world means inclusion. And they showed a statistic. The Olympics have been in the US and North America this many times. It's been in Europe this many times. It's been in Asia this many times. In South America, zero. Never has it ever been in South America. And you have an opportunity now to change that. And that pitch worked. And they ultimately then came to it. So like that was like one of the things I learned, just constantly finding ways that you can kind of, sell yourself your ideas. The other thing is we oftentimes think that it is the smartest person, it is the most talented person that will always get the best results. But it actually, at least for me, that was part of it. I never felt I was the smartest person in the room, the most talented, but I did try very, very hard. And I worked with a lot of tenacity. And I would say I was very lucky because many of the things that I tried to do happened to be at a time when either the right person was coming to visit or the electronic health record was going live or AI is coming into market, and all these things, they just kind of happened with the right timing. So it's really the three T's: talent, tenacity, and timing. And the last is, this is something that I'll close with and then I'll open it up for questions. Even though I'm at Microsoft, I think a lot of times people think, oh, you were at Microsoft, you can control this entire 1 billion or like multi-billion dollar organization to do things that, can be transformational. But with big companies, it's hard to kind of shift the entire organization. And what I've found is that what really makes the difference is when you work with customers and you work with partners, and they help define what they want, and then the companies help support them. So right now I'm working on an initiative around helping rural hospitals and rural healthcare find ways that they can better apply technology. And this is something that I have found the way that we have been most effective is by building an ecosystem of partners and clients and supporting technologies that are all working towards the same goal. And it's that customer focus that allows us to be able to explore and open up new opportunities. So for those of you that want to create that one single app that will solve the world's problems, or maybe trying to create this single solution, it's hard to do that. But if you can find a way that that app works with other apps and works with other technologies and it fits into the workflow and you created some kind of an ecosystem, it tends to be much more effective. So with that said, I'm going to close and see if there's any thoughts, questions, comments, and hopefully people stayed till the end.
Thank you so much, Dr. Rhew. I think it was really inspiring to hear about your career journey and like your three pivot moments and learn about all of your key takeaways and learnings. And I feel like it's really helpful for a high school student or a college student who's trying to learn how to make an impact or establish themselves to use these tips in as they move forward. So now we'll be kicking off the Q&A session. To everyone in the audience, feel free to add any questions that you have in the Q&A section and upvote any questions that you are interested in. I see that there are a few questions already, so I'll start us off with the first question. I see there's a question asking how the chief medical officer differs from medical scientists.
Yeah, it's a great question. And honestly, I'm sure there's probably a lot of variability in terms of how people define that. But I'll tell you, at least at Microsoft, the scientist is far more technical. The chief medical officer is far more clinical. So from my experiences, I tend to look at things in terms of outcomes, clinical outcomes. Does it improve the patient outcome? Does it reduce the cost? Does it make things more efficient? Does it lead to increased access to care? Those are the types of things that I have been trained to study and evaluate, and those are the things that we know technology can impact. And those are oftentimes the things that people and organizations care most about. But to do that, you actually need to have the technologies that work and the technologies that have been proven to be effective. And so you need the data scientists and the chief scientist officers to look at the technology and evaluate it against benchmarks to be able to understand how to best utilize the technologies. So we kind of work hand in hand. I'm kind of more on the front client-facing side, and then the scientific officers are more on the internal side. But it's really that combination of us working together that we can deliver the best results.
That makes perfect sense, Dr. Rhew. And I guess you've been talking a lot about delivering results and kind of how this technology has been changing over time with the rise of EMRs and other health tech. So I am curious, what excites you most now about the future of healthcare technology?
Yeah, I'm obviously AI is just extraordinary. I do think this is going to be the next transformative technology, and it's going to have its ups and downs, and people will think that there'll be bubbles, but all in all, it's going to make things so much better potentially. There are things that we always have to think about in terms of how it's done responsibly. So there's three things that I think of when I think of AI. I think of transformative use cases. I think of how we can build trust through responsible AI and how we can upskill an entire organization and population to be ready for it. I talked about the latter, so let me just first talk about the first two. So in terms of use cases, the most common use cases right now we're seeing are organizations using AI in healthcare. I'm talking specifically to improve the friction points or reduce the friction points. Things such as documenting into the electronic health record, using something called ambient voice. It allows you to be able to capture a conversation and convert that into the form of a note. These are proven technologies now that work very well in the workflow. Huge for if you've got clinicians that are burned out, just a game changer. But where I think the untapped opportunities lie are outside of the clinics and the hospitals in terms of screening large populations and finding the sickest of the sick and bringing them to care. If we want to talk about the biggest problems in healthcare today, at the top of the list will be access to affordable healthcare, rising cost of healthcare, and issues related to the lack of clinicians due to clinician and subspecialty shortages. These problems cannot be solved just by adding more money to it because we're finding that the costs just keep on rising. And what we also realize is that AI can help us because it can, in very unique ways, screen large populations and find the sickest of the sick. So one of the programs we launched in collaboration with multiple partners is called the Alliance for Healthcare from the Eye, where we're using AI on a routine eye exam. So like everyone's had an eye exam, that machine that captures it is not, the data is now being sent to the cloud and we're running AI on top of it. We're picking up things like diabetic retinopathy and there potentially other things like cardiovascular disease, hypertension, preeclampsia, chronic kidney disease, acute macular degeneration, glaucoma, potentially even biomarkers for things like Parkinson's, Alzheimer's, MS. So all from the eye. And why is it? Because when you look at the eye, it's like the portal into your entire body. You can see nerves, you can see blood vessels, you can see surrounding structures, and it oftentimes is the area that is impacted first with a lot of these conditions. So it's extraordinary. In Texas, one of the first places that we rolled this out, the first 50 patients that were screened, 20% of them had advanced stage eye disease requiring urgent evaluation. These are people in the next 3 to 5 years, they'll go blind, but we're finding them before they go blind. I mean, that's a huge, huge satisfier to know that we can actually apply a technology on people that don't even realize that they have these conditions and bring them to care. Turns out that 5% of the population account for 50% of the total cost of care. 20% account for 80%. We now, for the first time ever, have an opportunity to find those 5% before they actually incur the costs. That could be a game changer. So that's what excites me about, the technologies. The second is around responsible use. I do think that it's now imperative that every organization understand how do we apply AI responsibly. Do we know what AI is running in our systems? Have we tested it on local data sets and diverse data sets? Do we continue to monitor for outcomes and impact and drift? And do we look for bias? And do we have a streamlined governance process? And if we do those 5 things, we're in a much better state in terms of deploying AI.
Wow, I feel like it's really incredible to like hear about like the potential of technology and how much it's like accelerating healthcare and like making people's lives better. And I think it's really cool to see how that works. And I definitely do think it's very important to be looking at the um, the responsible use of AI as well. And that's definitely something I'm sure a lot of people had questions on. I see the next question. There's a Stanford medical student who had a question asking, how did you decide to stop being a practicing physician? So yeah.
Yeah, well, it wasn't one of those things that just all of a sudden came. It was as the workload started increasing, and keep in mind, this was when I was, at Cerner, and then eventually it was sold to Hearst with a company called Zinx Health. The amount of travel and required work that was required to help systems across the country and the globe go live was just steadily increasing. And so I found myself at one point, about 50% of my time was doing the clinical work, and then the other 50% was doing this, kind of health informatics type of work. And then it was more 40/60, and then 20/80, 10/90, 5/95, and then it was like 1/99. And eventually I cut the umbilical cord because you couldn't do it. And it was so challenging. Also, my clinical activities were requiring that I do a one month of in-person rounds, as the attending, and then also, 2 months of the ambulatory. And I was just constantly asking for cross coverage, and it wasn't good for patient care either. So for a variety of reasons, I decided it was just time. But the reality is, I actually feel much more rewarded in what I do today because I feel like I'm impacting a larger number of people than I could have if I were just seeing patients through my traditional route. So I do think I'm practicing medicine, but in a different way.
That makes perfect sense, Doctor. And you have changed your career path so many times. And I guess in your current career spot, what would you say is your favorite part about your job?
Oh, definitely. It's the people, both at Microsoft, outside of Microsoft, getting a chance to meet so many people. And I love doing these. I love talking to the younger generation, sharing things that I've seen. That's part of the reason why I'm an adjunct professor at Stanford. I love to teach. I love to provide insights. When I was growing up, I always wished that I had someone who could share a little bit about what's going on in the real world, because a lot of my decisions were based off of just what others talk about. But it's so valuable to hear from folks that are actually doing things that are in the real world and giving you insights. So I'm all about helping the next generation. What is it called? Pay it forward. Find a way that we can help everyone learn from what we've done and hopefully do even better stuff.
Yeah. I feel like that's definitely a great thought. I think the next question was that someone had a question on what the biggest challenge you faced was and how you overcame it, and what you would recommend to a high school student who wants to get into AI.
Yeah, what I always thought was the biggest challenge or the biggest barrier has always been the greatest opportunity. And it seems so strange because you would say, how could a failure lead to be one of the best things? When I was applying so this is when I was a fellow, infectious disease fellow at UCLA, I would always get paged for antibiotic approvals. And they would always say, oh, we've got this patient that has this certain condition. It's a community-acquired pneumonia, and we want to order ceftazidime. And I would be like, or I mean, ceftriaxone. And I would be like, well, that's community-acquired pneumonia. That's consistent with the guidelines, approved. And they would just type in approved by ID. And I said, well, they're constantly calling me in the middle of the night throughout the day for these things that are pretty routine. What I'm going to do is I'm going to actually build a protocol and put it on the hospital intranet site. So when anyone wants to approve an antibiotic, they just go to the guidelines. They just find the guideline. They click on the specific area. They put the patient name, and then it automatically gets approved. But it documents that this patient is being prescribed this antibiotic for this indication, which is even better than the call because we had no documentation that the conversation ever occurred and no attestation that the patient was being treated for whatever. So this time there's actually real attestation. So I was like super excited. I applied for what's called a VA Career Development Award and I didn't get it. And the reason I didn't get it was because they said, and this is sort of the central office in the VA, they said, well, if you're going to do this, you're going to need to get a consent form for every patient to do this. And I was like, well, that's impossible. I can't consent for antibiotic approvals. You can't consent a patient. They're like intubated or, and so I was like, well, I can't really pursue that career. And I pivoted. And that was one of the factors that pushed me to go and leave clinical practice and go ultimately to the to working in industry. And it's like one of those things where I was kind of crushed at the time because I thought that was what I wanted to do. But again, sometimes these failures lead to the biggest opportunities.
So I'd like to give a huge thank you to Dr. Rhew. This was such an informative webinar, and I'm pretty sure everyone learned a lot about your career and your use of tech in healthcare. I really enjoyed learning about like your three pivots in your career and like how everything is so unexpected, but like with the timing and the skills and the hard work, you can get to such an amazing spot in life. And I think that was very inspiring to hear and something that I think we all aspire to reach. And I'm confident that what we learned today will significantly benefit our future careers and provide us with a unique perspective on AI in healthcare.
We also want to thank all of our participants today for their time and for asking such thoughtful questions, which really helped keep this webinar educative and informative for everyone. And finally, thanks to AIMI for planning this wonderful event and making this all possible. And for all of you guys, keep an eye out on the AIMI website for details on the next episode. And we're looking forward to seeing them at the and we're looking forward to seeing everyone at the info session as well as at AI Plus Health. And thank you so much, Dr. Rhew, for your great talk, because it was really inspiring to hear about your career journey and key takeaways and learnings. And I feel like these are great tips for students looking to make an impact, especially at the high school and college age, and figuring out how to get a job in this new AI age.
Thanks so much. It was a pleasure being here, and thanks for great moderating for the panel, for this discussion. And if anyone has any follow-ups and they'd like to reach out to me, we posted in the webinar chat my LinkedIn, which is David Rhew. I also have a new Instagram account. It's Dr. David Rhew. I'm also on X, DRHEW. So thank you all for everything, and look forward to seeing you soon.